I had a friend yesterday, one of my clients, uh, lives in southern West Virginia that actually drives to Pittsburgh for their cancer treatment. And he had prostate cancer. And we've been working with him for almost a year till he got yesterday the clean bill of health. But he got the result of his PET scan back, and everything was clear. The lymphs were clear. Everything looked clear, except it flagged that arterial calcification. This is getting to be a new problem, primarily because we as Americans have had a love affair going with calcium forming foods, milks, cheeses, etc. We've also had an issue with the inability of the body to excrete it back off because we've all been low on vitamin K. So, where's this calcium going to go in men in particular? It can deposit on the outside of the arteries. It can cause arterial stiffness by precipitating on the outside of the arteries. There's now a new test called an arterial calcium scoring, where they do a CT scan, real quick little CT scan over your heart to find out if this is happening. Now, I, it's just amazing to me when they do this test. The first thing the doctors prescribe is a statin drug, which
Mm.
actually has absolutely no effect on coronary calcification. But somehow they believe that that's going to be helping. Some other signs of vitamin K deficiency: I'm brushing my teeth and my gums are bleeding all the time. Bleeding gums, easy bruising can become another one of those factors. Heavy and painful menstruation. Now, let me just say this. It's just me now. If I have a young lady that comes to me and says, the mom comes to me and says, my 17-year-old daughter, her periods are so heavy that for 3 and 4 days, she's down and out. I have used, and again, this is just me, don't quote me on this, extremely high doses of vitamin K. I would go in with two of those 4 times a day, the Super K2 Plus, and it was amazing to me how I would start that 1 or 2 days before menses started, and it helped with clotting so that I didn't get that heavy menstrual flow at that time. So it helped to soothe that along with using like Ester Cleanse to help balance out that woman's cycles. Because of its role in blood clotting and calcium balance, maintaining healthy levels of vitamin K2 while pregnant has been found to promote fetal bone growth and reduce the risk of excessive bleeding during childbirth. Now, you try to find an OB-GYN that's going to recommend vitamin K for a pregnant woman, but it's something that can be checked in blood work and should be utilized during the whole course of a pregnancy. So, how do they work together? Vitamin D3 stimulates the uptake of dietary and supplemental calcium, which raises blood calcium levels. While calcium is needed for bone growth and skeletal health, elevated calcium levels can lead to calcium deposition in soft tissue, such as blood vessels, tendon, and joints. Soft tissue and vascular calcification is a significant risk factor for coronary heart disease. Vitamin K2 redirects calcium from soft tissue into the bones, which produces blood calcium levels, reduces blood calcium levels, and helps significantly lower the risk of calcium deposits into arteries and soft tissue. Taking D3 without maintaining an adequate vitamin K2 status can lead to arterial plaque formation and cardiovascular disease, especially in individuals with high calcium intake. It can lead to. So again, the concept of getting somebody away from strictly vitamin D into the Super K2 Plus, critical factor.
Doc,
Okay.
how about a connection between vitamin K2 deficiency and kidney stones? Have you seen that?
Absolutely. Yeah, absolutely. And again, most doctors would say the reason you got the kidney stones is from the vitamin D. And it's like, no, no, no. Most of those become a calcium carbonate deposition in the kidney stone. Most of them. You'll see uric acid also, but most of them are calcium carbonate. And if you go through that whole concept where you take the vitamin D simultaneously with vitamin K, it helps to mobilize that calcium carbonate that's already forming sand in the kidneys and helping it be redirected out of the kidneys into the bloodstream and put back into the bone where it belongs. So, absolutely. Okay, next one. We still have time, Joe. We still have time.
We're
We're going to
good.
talk here
Yep.
about power fuel. Power fuel, best way, super creatine.
Hey, Lynn, before we go into that, thank you for your
Yes.
help with that client. I think it was last week. She had a patient with really high calcium for
Right.
years, and her parathyroid was fine, and it was like a light bulb went off. I'm like, of course, Super K2. I mean, or really, I mean, Super K2 really just is the best because it's so high in K2, but I just had never really thought about that. Can you share your thoughts on that with the team?
Um, yes, 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 yes. Let's just start out by saying it's rare, almost impossibly rare to see a doctor recommend vitamin K or even check vitamin K levels. It's I'm going to say that the average American is so depleted on vitamin K that they are actually in a danger zone. There's a reason that there's so much with kidney stones. There's a reason that we see so much osteoporosis and osteopenia in this country. We thought for a while it's just because they have all these new equipment for doing bone densities on women that they're carving this little niche so that they can put everybody on that injectable Prolia. And if you look at it in the reverse form, this concept of K and D together, taking calcium and redirecting it back into the bone versus what the pharmaceutical industry says, which is Prolia, which is stopping the growth of bone. So it's stopping the normal 2 weeks on, 2 week off transition in bone health. 2 weeks of remodeling, 2 weeks of rebuilding. So you got this 2 week window where if you're keeping the proper levels of vitamin K, the body can then utilize that to push it back into bone. So 2 weeks, it's not going to do a whole bunch. 2 weeks, it's going to really do the bulk of its work. So it's 2 weeks on, 2 weeks off. That's the normal course of bone health and can make a substantial difference in health. Any other questions on that? Okay, next one.
Did you mean 2 weeks on and 2 weeks off of K2?
No, I mean, take it all the time. For 2 weeks, it's not going to really do anything.
Oh,
You're not
got
going to
you.
see substantial change. So if somebody did it, I'm going to just take it for 2 weeks out of the month. You're not going to see anything. It has to be taken on a regular basis every day for the entire month.
Okay, I heard you wrong. Thanks. Appreciate it.
Hey, Len,
All right.
share one more time. Why does Super K2 Plus help with kidney stones? What does it do?
It helps read it. First of all, the vitamin D is going to try to mobilize calcium wherever it is.
Okay.
Mobilize it. It's going to look for it out of our food sources. It's going to look at it through the bloodstream. It's going to look at for it in the liver and in the kidney. And it's looking for calcium. And it's going to mobilize that to move because we got to get it from where it is in the circulatory system back into bone. So as soon as we take a high enough dose of vitamin D, you're going to see a mobilization of calcium. Now, if we started calcium carbonate deposition into the kidneys, it's going to act like Velcro. So as that calcium, if you're just going to do vitamin D, that's going to start to mobilize some of that calcium, and just like Velcro, it can actually redeposit some more into the kidneys. So that's why it becomes critical that when you're doing the vitamin K, which is going to help to get that calcium dislodged simultaneously as the vitamin D is mobilizing it to move, the vitamin K is going to dislodge it to try to get it out of wherever it is and mobilize it together. So it's the synergism of the two preps together that work for mobilization to stop this kind of a problem.
Awesome. Thank you. Thanks for breaking it down for the layperson.
Yeah, and it makes sense, if you could say, well, I'm taking 5,000 IUs of vitamin D a day. That's great, fantastic, and I take maybe 10,000 a day. That's great. Are you taking any vitamin K? Because you need to be taking vitamin K with it to get the full effect, the synergism of keeping you healthy. You want to break down any kind of risk factors for bone health, coronary calcification, cardiovascular disease, and now they're even saying mental health. So you do this properly, you can maintain the youth factor even better. Okay, Let's see, what time is it? We got time for one more.
Yeah, we did.
Rethinking Obesity. This is from the Journal of Bone, Joint, and Muscle Health. Rethinking Obesity. Is America facing a muscle crisis? A new class of drugs touted by influencers and celebrities is rising in popularity. However, not all weight loss is healthy. Numbers indicate that America has an obesity problem. U.S. obesity prevalence has surged over the last decade, with 22 states reporting adult obesity rates over 35%. Dr. Gabrielle Lyon, a physician specializing in muscle-centric medicine, offers a completely different perspective. We don't have an obesity epidemic. What we really have is a midlife muscle crisis, she said. This shift highlights a crucial yet often looked factor in weight management, your muscle mass. The issue of muscle mass versus fat becomes particularly critical as the world turns to a new class of drugs that aid in weight loss. Medications such as Ozempic, known for their appetite-suppressing effects, promise significant weight loss and are gaining popularity. According to a tracking poll, 12% of Americans are now using the drug on a regular basis. A 2023 study in Lancet confirms its efficacy, showing that adults lose about 15% of their body weight on average with GLP-1 agonists. Dr. Peter Attia, a physician specializing in longevity, wrote on his website, big asterisk, he says, not all weight loss is healthy. In a study in the New England Journal of Medicine highlights the concerning downside. With GLP-1 agonists such as Ozempic, about 40% of the weight loss is lean muscle mass. GLP agonists have been celebrated for their potency in reducing body mass, but lean mass accounts for an alarming proportion of this weight loss. Dr. Attia also said that while GLP-1 agonists such as Ozempic can offer health benefits for obese individuals, they come with risks. Lean muscle mass affects the body's basal metabolic rate. Say that again. Lean muscle mass affects the body's basal metabolic rate. We can take supplements till they come out our ears. If we're losing lean muscle, our basal metabolic rate is going to have a heck of a time trying to get boosted. That's calories burned at rest. Muscle tissue is metabolically active and requires more energy to maintain than fat tissue. Thus, more muscle means more calories burned. However, the effects of the body's metabolic rate might not be as significant as believed. A study in the Frontiers in Nutrition found that each kilogram of added muscle raises the bone mineral or the body's metabolic rate by only 13 calories per day. Researchers concluded that this change is non-significant, non-meaningful, challenging the belief that muscle hypertrophy, an increase in muscle size and strength, substantially boost daily energy needs. So contrary to what we've known for years, we keep putting on muscle mass, it's going to boost our metabolic rate. While muscle does contribute to calorie burning, clarifies for each pound of muscle burns only about 10 calories at rest. The metabolic power is this. Well-trained muscle tissue is more efficient and effective at utilizing calories. This article goes on to say a couple more highlights. Obesity is at its core is a disease of the muscle. We don't have a battle of the belly. What we have is a battle of the bicep. So it goes on to say there's three ways muscle aids weight management. Muscle plays a key role in managing our weight because it enhances our metabolism. Muscle enhances metabolism, helps to regulate glucose, balances your hormones. Muscle is medicine. We need to change the paradigm of medicine to think about muscle as medicine. In this book, Dr. Lyon recommends resistance training and a protein-forward diet to combat muscle loss. She talks about using, you ready? Branched-chain amino acids, whey-based proteins, creatine, and magnesium to start building muscle correctly and boosting your metabolic rate by doing so. So again, with Best Whey, adding branched-chain amino acids, super creatine plus to it. But again, they're now saying that magnesium and maintaining higher than normal magnesium levels helps the body utilize insulin more effectively so that we can utilize our glucose more effectively so that we could turn around and start building muscle more effectively, which is going to help the body then get rid of the fat accumulation that's been on the body. So we can go back to thermogenesis and all the concepts there. Make sure that we're using whey-based protein and creatine simultaneously with it, and adding the branched chain amino acids, which can make a substantial change in giving the body the raw material it needs for boosting muscle health.
Len,
think
what if you had a creatine that was buffered with magnesium? Like
Exactly. And there's a reason for it. You know that, Joe. It's just so that we can maintain the blood levels. I'm talking about even throwing some mag on top of that, because the mag complete has an amazing way of helping insulin to work more effectively.
And then you got the magnesium and the Super K2. A great way to do that, because that's for preps, right? Like if you're going to do that for muscle being medicine, the best way, vanilla and super creatine taste amazing for breakfast. Amazing. Amazing. I think it tastes best that way. And then the branched chain amino acids with the magnesium complete powder at night for like a little mocktail, because branched chain amino acids help you recover from the day anyway. And then so does magnesium, helps you sleep. And you got yourself a little, it's a raspberry lemonade and the branched chain amino acids, and that's the lemonade effervescent and the magnesium powder. It's a perfect blend. Just blend two of them together so you don't feel like you're taking four. You're just taking a morning cocktail and an evening cocktail.
May I add something? Just because I know this is going to be
Yes.
distributed through the World of Wellness. I did the InBody thing on Wednesday, and then I had Shelby look at my results, and she said my number for my, what was it for the fat, the body fat was 31, and we talked about, she's a personal trainer, and she said you need to do more weightlifting to build more muscle and incorporate these 4 formulas. So this is going towards, wow, those clients who might be coming in here that may not know about the InBody thing downstairs, and they can have a measurement to look at.
Well,
Yeah.
we're doing free demos on it
Yeah,
today and tomorrow.
yeah,
Yeah.
So that's, I have a plan. I need to work on it.
Awesome.
Yeah.
Well, I definitely used that on the tennis court, playing in 100-degree heat this summer out in Orlando, and that worked really well for me. Thanks for the tip, Joe and Dr. Len. I wanted to say, first of all, thank you so much for your donation of time today and all of the goodness that you shared with us, Dr. Len. I'm understanding that in the beginning, we had a sound issue with the live stream. So anybody that was disappointed that they couldn't hear you, we are going to repost this later since we do have sound and we recorded it to the cloud. We've since fixed the streaming issue, but I just wanted to make sure that people knew that. And for those of you who are joining us, Joe, you want to give everybody an idea of what to expect since it's Wellness Weekend here in Pittsburgh?
It's Wellness Weekend here in Pittsburgh, and Tara mentioned the InBody. It's a brand new testing device that we have here at the World of Wellness. So if you want to come in today or tomorrow and get a free body composition scan, please do. It takes minutes, it's non-invasive, and you'll get a breakdown of muscle, fat, and water in extra and intracellular water in your body. So this tells you a lot about what's going on internally and where you need to work. So we're doing those all this weekend. We're going to have workshops all through today and tomorrow. So lots of things going on, free shakes, smoothies, the works. Come on down. And Doc, I want to ask you one last question. You said that last article was in a publication called Frontiers of Nutrition.
Really?
How about that, huh?
I wonder how old that is. I think we might need a little cease and desist there.
Oh my goodness gracious. Or let's get some free press, baby.
Yeah, free press.
How about that?
Yeah.
Dr. Len, basically when you were talking about muscle in particular and how important that is for weight loss and generating energy, Rhonda, I couldn't help but think of our friend and trainer, Nikki Fit. That is her whole program and the whole basis of her program. She's coming to our professional training event in Pittsburgh. We definitely have to get those two brains together.
Yeah, she says muscle is medicine, just like that doctor said. And just like
Exactly.
Mm-hmm.
All right. Well, everybody make it a great day. And if you're on with us live, the Jamie and Joe show is about to roll right here at 10 o'clock. So we'll see you guys